Good morning. I'm called Along Benadame. Today I'm going to present a case that we had in our facility here. I'm at Lira Regional Referral Hospital, and we had a patient who came in. The patient was a referral from one of the health centers. The center is called Ogur Health Center 3. So the patient was referred in after being managed from there, but they realized it was a bit of a complicated case, so the patient was referred in here to the emergency department. So the patient was brought on the 12th of June 2026, and on receiving the patient, we realized that the patient, first of all, came in with high-grade fevers, and the patient had a stiff neck. The patient was vomiting, and according to the report that the attendant gave us, the attendant said that the patient had initially had 2 convulsions. So when the patient walked in, we asked for the status of the patient, and we were told the patient was diagnosed to be HIV positive in the year 2005, and the patient has been getting his ART from Ogur Health Center. But of course, on asking more questions, we realized that the patient has not been having good adherence on his ART and we cancelled the patient. And of course, we did a crack test, and the crack test turned out to be positive. So after doing the crack test and it turning out to be positive, we of course picked some samples to do things like RFTs, LFTs, CPCs, to know maybe if at all there's any other infection. But of course, we also did tapping, and while doing the tapping, we realized that the patient had high jetting pressures, and we realized that the color of the cerebrospinal fluids were not clear. And of course, we managed to pick 20 mils of the CSF, which we have taken for analysis. And briefly, I would just want to take us through meningitis. So first of all, meningitis is just an inflammation or infection of the brain and the spinal cord. What are the signs and symptoms that someone will present with in case maybe if they have meningitis? One, the person will have high-grade fever. Some coming when they are vomiting. Others would always have things like a stiff neck, just like the way our participant came in. He had a stiff neck, and then of course others come in sweating profusely. Of course, there is also body weakness. Those are the symptoms that you can expect. And this participant of ours, when we tried to do the GCS of the participant, we realized that the patient was disoriented on time and place. The patient couldn't really tell where exactly they were, and they couldn't tell what time it was, what time of the day it was. When we tried to ask questions like who is your president, we realized that the patient was in a confused state. So the patient is not in position to make their own decisions. Now, I would want to just briefly talk on the types of meningitis. So we have bacterial meningitis. So bacterial meningitis is just inflammation of the brain and the spinal cord caused by bacterial infection or by bacteria. And usually when people got with bacterial meningitis, they're just put on high dose antibiotics, and then they get to recover from that. There's also TB meningitis. So when someone has TB meningitis, they are just put on anti-TBs, and usually the meningitis clears. Today we are talking about cryptococcal meningitis because these participants of ours has cryptococcal meningitis basing on the crack test which we have done and which is positive. So cryptococcal meningitis is usually caused by fungus, Cryptococcus. It's usually C. newformans, and I've already talked of the signs and symptoms that the patient came in with. So I just want to briefly take us through the treatment plan.